Hi, so good morning, everybody. This is Dr. Jennifer Vines. I'm the health officer for Multnomah County. I'm joined by Chris Voss, our Director of Emergency Management. We're here to answer your questions. I know people either went to bed last night or woke up this morning to the news that the governor has paused all county reopening applications, including ours that was submitted June 5th, based on what they're seeing statewide in terms of coronavirus activity. And so we are happy to take your questions.
Dr. Vines, can you tell us anything about the number yesterday, I believe 42 in Multnomah County? Can you give any elaboration of where those positive tests came from?
I don't have that information specifically. Again, our metric is to reach cases within 24 hours of report. So those phone calls got made yesterday, and so I don't have information to share yet. Those are detailed phone calls tracing people's whereabouts during the time they were infectious. So it'll be at least 1 or 2 more days before we have a clear picture on that particular day's report.
Dr. Vines, it's Pat from KGW. This morning, they said one of the concerns with Multnomah County was that 40% of the recent cases could not be traced. Could you talk about that? What's going on there?
Yeah, thanks, Pat. Thanks for the chance to kind of unpack that particular metric. This is a metric that the state is using. I believe it's part of their phase 2 criteria, so it wasn't one that we were particularly focused on. But what it speaks to is the level of community-wide transmission. So just to be clear, this is not 40% of people who don't get a call from a contact tracer. On the contrary, we're doing very well there. These are 40% of cases not immediately linked to a known source. That means that they're not linked to an outbreak or they're not linked to a known cluster of cases. So this can be a sign, again, of community transmission. I will just say, again, that the work of public health and our contact tracing is delicate and it takes time. So there can be a lag in linking people back to a specific transmission chain of events. But you're correct that the state did cite this number this morning, I think globally, in their concern around a potential increase in community transmission.
So Dr. Vines, can you talk about this? These are all lagging indicators that the state is citing, and what would you expect to see as a public health professional in terms of the trend lines here? And did you get any indication from the state as to the criteria they'll be using to maybe resume or let Multnomah County into phase 1?
Certainly. Thank you for acknowledging that these are difficult decisions to make. There is a lag. What we're seeing now is the result of viral transmission that happened days, if not weeks ago. So we are continually behind and having to try to figure out where we've been and where we're going. The state has not specifically told Multnomah County anything specifically that we need to do or particularly change within the next week. I expect to be in conversation with them. They did mention this morning their concern over our increase in hospitalizations over the last 2 weeks. And just to put that in perspective, from a high the week of April 12th of 39 hospitalizations, the last 4 weeks in Multnomah County have seen 13, 9, 11, and 14 hospitalizations per week. So we acknowledged that to our board on Wednesday. We felt that with such small numbers and overall small numbers in hospitalizations, knowing that our health systems had capacity, and given the context of a population of over 800,000 people, we felt that was still an okay context for reopening. The state, of course, has a different context, and they have to look statewide. And you heard the governor clearly say that as she looks around the state, she has concerns outside of Multnomah County as well.
Hi, Dr. Vines. This is Shane Dixon Kavanaugh from the Oregonian. I know you said that in response to Nigel's question that you can't provide any information about the 43 cases reported yesterday, but there have been another 100 other additional cases in Multnomah County over the last week at least. Could you please give us some details about those particular cases? And as much detail as you can, just so we have a better understanding of where this infection is in the community right now.
So thank you. In broad brush strokes, we expected case counts to go up. We know this virus spreads easily between people. We've stood up more testing. So as you test more, you tend to find more. We have been very upfront that this virus has disproportionately affected communities of color. And so in general, the cases that we're seeing are often results of close household contacts or social networks. Some of these are clusters related to specific workplaces, and a lot of it is close family household contacts. So we are stepping up our engagement in a culturally appropriate way, again, for these close family networks, knowing that people, regardless of our official reopening status, want to reconnect with loved ones, want to see family members. And so I think we have we can do more in terms of making sure people are making those social connections safely.
Nick Budnick, Portland Tribune. I am wondering, on May the 15th, Chair Kafoury talked about being a little surprised at phase 0.5, as she talked about, of increased mobility and contact, and how, in contrast, Multnomah County was going to do it.
Oh, Nick, you've gone on mute.
Sorry about that. Multnomah County sought to do it right and have everything in place. Of course, now the governor, in part in reaction to what's happened in other counties, has hit this pause, and Multnomah County is been caught up in that, seemingly. Do county officials feel burned? What does it feel like?
I think what you're getting at, Nick, is potentially a sense of gamesmanship here as far as counties timing their reopening. I don't think we played that game. We knew the numbers would go up. We wanted to be ready. We felt like we were ready. We have been cautious as a county. The governor wants to be cautious in her state role. And so we certainly can't fault her for that.
I don't mean gamesmanship. I mean the sense of frustration that I'm guessing some people are feeling over there.
No question that we acknowledge the frustration of business owners. We acknowledge the timing of the announcement. And this was certainly not the outcome we expected when we submitted our application on June 5th. So I will acknowledge frustration, disappointment are probably understatements for those who were ready to turn their lights on today and get back to work. At the same time, we've also heard in the last couple of weeks leading up to today, a lot of people were still really worried about going back to work and concerned about viral spread in our community. So again, these are very difficult decisions to make based on small numbers, potentially short time windows. So this is, again, the governor said there's no playbook. So I think we're all doing the best we can.
Thank you.
Dr. Vines, is there any concern with the protests now reaching their 2-week mark that those numbers could continue to rise because we've had so many people gathering together in close proximity?
It's certainly a concern. Mass gatherings were one of the first things that we took off the table as far as a public health prevention measure. We felt like the soonest we would see impact from viral spread from the protests was this week. We are asking people who test positive if they attended any kind of large gathering, whether it's indoor or outdoor. And I think that in the coming days and weeks, we may have more information, we may have more cases, but that remains to be seen. I do see people outside, I see people wearing face coverings, I see people taking precautions, and we have encouraged testing for anybody who has had symptoms, who has been to a protest. So that picture may come into clearer focus in the coming days and weeks, but it is a concern.
Hi, Dr. Vine. Shane Kavanaugh again from the Oregonian. On the topic of protests, Dr. Seidlinger said during the press conference this morning that the Oregon Health Authority did not have any reports of people who've tested positive who've attended one of these demonstrations in Portland or elsewhere. Can you say with certainty today, right now, that Multnomah County has not had a single case of COVID-19 that involved an individual who attended a protest or demonstration in the county?
I certainly cannot say that for Multnomah County, given the size of the protests, given that people may only just now be developing symptoms and seeking testing. And given that our contact tracers are asking these questions, but that people may choose not to share the specifics of where they've been or what kind of gathering they've attended. So no, I can't say that.
But has there been any positive cases tied to demonstrations in Portland to date?
To my knowledge, and I would have to check to give you the most current information. To my knowledge, I don't think we're aware of any specific cases linked directly to the protests. Again, people have a series of potential exposures. So I would say I'd have to update you later today, but at this point, I don't think we have cases that we attribute directly to having attended a protest.
But that's not the question that I'm asking. I'm asking if there are individuals who have tested positive for COVID-19 who have told your case investigators that they have been at protests or demonstrations. That's the question I'm asking.
I see. I understand it now. I would have to get back to you. I would have to talk to our team and see how yesterday's interviews went and what we might be able to share.
I just want to say really quickly, and sorry for taking up so much time, I've been asking this question all week to Multnomah County, and I have not gotten a response, so I'm hoping you can get that response to me today, please.
Dr. Vines, should the county actually be advising folks against attending these protests? I recognize the sensitivity of that, but given your concerns over exactly these kind of gatherings, should the county be upfront about this and say, this is a high risk and we need to put a stop to this?
Sure. So I think you acknowledged the sensitivity of this, and in public health, we're very sensitive to the effects of racism on people's health. It is a lifelong effect. It is a long-standing issue in our communities of color, and so we are not discouraging people from attending protests for a different but equally pressing public health issue, which unfortunately contradicts much of our guidance around COVID-19. So we've put out messages around face coverings, around physical distancing, around not participating if you're sick, and recognize that racism as a public health issue for many people is the same, if not more pressing than the virus itself.
Dr. Vines, could you please speak as to whether or not there are particular industries, workplace type activities that are driving this? Do you have any information on particular sectors where these cases are originating in the surge?
I can say in general, we have had worksite outbreaks. These tend to be where people are in close proximity. And so we've offered testing. We've put in public health precautions. Some of these we monitor and they stop with those precautions. Others expand as more people get sick, and we continue to work with the employer. So again, it tends to be people in close quarters working together, often but not always without full precautions.
Are there particular types of employers that are your focus, or particular types of industries?
I can say in general, there's been a lot of attention on migrant seasonal farm workers as being at risk, and so we have been part of the response both to outbreaks and on the prevention side for what employers can do for that specific population.
Thank you.
Dr. Vines, Washington and Clackamas County, along with Marion County, obviously got to go into phase one a couple weeks ahead of us even now. Are we able to learn anything from them? A number of those counties also saw a spike in those numbers that came out yesterday. Is there anything that we can glean from them opening up earlier than us?
I think it's a really good point. I think we're always looking around and learning and looking at what other places are doing and what they're seeing. That said, we're doing a delicate dance here with a virus that depends minute to minute on how people behave and what precautions they take. So I think we do look around for lessons. I did notice that Clackamas County had acknowledged their increase in cases. I think Washington County has also seen an increase, as you refer to. So I think we're looking around and seeing what we can learn, what we can do better, and in particular how we can keep people from being hospitalized and dying from this virus. That is the ultimate public health goal.
And what do you say to Multnomah County residents who may be frustrated that they can't get back to work or just even back to day-to-day normalcy when they are seeing so many other counties getting that opportunity?
I fully acknowledge the disappointment, the frustration, a sense of potential betrayal, feeling like today was going to be the day. I think our chair and our leadership were clear that they wanted to take a close look at things, that it depended on the state's review. And unfortunately, the timing is not what I would have liked to see. But again, we've been cautious as a county. We can't fault the governor for wanting to be cautious in her state role. And so I have to ask the residents of Multnomah County to bear with us, and I have to thank them with full humility for doing what they can and for bearing with us through a difficult, historic time.
Dr. Vines, I know that the statewide decision obviously was not yours, but as far as Multnomah County, I'm hoping I can help you clarify what I think I'm hearing. And that is, it seems like you felt like all the metrics were in place for Multnomah to do phase one.
We acknowledged that we had had an uptick in hospitalizations. We as a county felt like we were prepared for that, which is why we moved forward. The state has cited that as one of many reasons for putting the pause statewide. Again, I think looking through a county lens is different than looking through a state lens, but we were confident in our application despite that increase of single-digit numbers in hospitalizations over the last few weeks.
Dr. Vines,
Sorry, go ahead.
sorry about that. Could you speak to the mobility data you've seen and what it tells you about how Multnomah County residents or Oregonians in general have been acting? Have they been social distancing, or do you feel that the data you've seen suggests that people have become complacent?
I have not poured over the data around, I think you're speaking to the metric of what percentage of cases are not traced to a source or a known outbreak. I have not poured over that data. I think there can be some information there, but I think before saying more, I would have to get back to you. I will just acknowledge that there is certainly fatigue. We are asking a lot of people. It is not human instinct to stay away from others and to disrupt routines for this long. So I just want to acknowledge that we are asking a lot of people and continue to ask a lot of people, but I would have to get back to you on exactly what we think the data is telling us.
Thank you.
Dr. Vines, it's Mila with KGW. I was just wondering, with the trends going up week over week at this point, I think we can all assume that we're going to be in a very similar position 1 week from now. So are you expecting a phase one reopening, or are you expecting to be in the same holding pattern for the time being?
That's, I think, the question everybody wants an answer to. I think we'll be in conversation with the state. We'll be re-examining our county indicators. The governor and her team will be re-examining Multnomah County within the context more broadly of the state. And I think we'll be figuring out what makes sense as a way forward. So I think we will be continuing our work and working in concert with the state. We are a public health system. And so I expect there to be a dialogue in the coming week about what the future holds for Multnomah County.
Right, and a lot has been discussed about what you would say to business owners and other Multnomah County residents, but what do you say moving forward? Do businesses go ahead and get ready for next week, or do we just kind of sit around and wait and see how this looks?
Yeah, great question. Again, we're not even 24 hours into this decision, so I don't have a message for business owners yet. I wish I did. And the last thing I want to do is continue to yo-yo people with a yes/no. So again, the timing of this decision was not what I would have liked, but that's the governor's discretion. And so I think we want to get clear within Multnomah County and with the state so that we have a clear message for the public going forward, even if we don't know.
Can you bring us through, you said you were surprised and maybe learned this morning, but is there any more detail on when you learned this and what that process looked like in terms of communication with the state?
So we were in contact with the state briefly yesterday around our application. We heard early concerns that there was a broader context statewide in which our application was being considered. And then we heard yesterday evening the governor's decision just before her press release.
Dr. Vines, Sarah Hurwitz here with Channel 12. One of the conversations that we were having in our newsroom meeting this morning was about certain businesses that can be open statewide, like retail, for example, and boutiques and things like that. Can you talk from just a health and epidemiologist standpoint why some activities like that and businesses are able to be open versus things like, a restaurant, a sit-down restaurant, or a barber shop within Multnomah County cannot, in terms of risk?
I think, so this was the state's framework, and they invited Multnomah County to give input into their framework. I think it's a difficult question because anytime people mix, there is a risk of virus transmission. And so which businesses open versus, now versus phase 1 or phase 2, that's a values decision. That's an economic consideration. And so that's a much more complex equation than just public health risk. So I wasn't part of the decision around the sort of pre-opening retail opening that the governor opted for. So she would have to speak to her reasoning for that choice and how she specifically chose to phase businesses.
So you're not able to kind of talk on risk in general about, like, say, going to a retail shop versus sitting in a restaurant, what kind of health risk that would pose?
I think no, I can't. The decisions around reopening and risk and businesses, I think that's a more complicated equation of transmission, ability to put in mitigation, and then economic and business community considerations that I think I'm not at a level to answer.
Okay, thank you.
Dr. Vines, I am wondering, I've written about how state epidemiologists, prior to governors announcing her reopening timing and framework, had hoped to delay that a week or two in order to bring down the number of active infections and make it easier to control the virus. Did Multnomah County feel similarly? Do you feel that, or did you feel at the time that waiting longer would have been helpful to you?
Our actions, I think, speak for themselves. Multnomah County acknowledged very early on that we had the most to lose from reopening too soon. The governor made her decision around the reopening on May 15th of retail and certain other activities. We, again, took our time to build a really strong system to contain this virus. And so I think ultimately, to the extent that that initial reopening was a bit of a stress test on our system, I think we've seen the results now, and it's time to relook at the data, look at what we have in place, and decide with the state how to move forward.
Thank you.
Dr. Vines, I'd like to ask about testing of protesters. We've seen in some other cities that they are offering free testing for anybody who has been to a large gathering like a protest, and we've seen in some places that they're urging anybody who has been to a protest, even if they're asymptomatic, to get testing. Can you talk a little bit more about what Multnomah County is doing on this topic?
So for now, we've encouraged anyone who attended the protests who has symptoms to get tested. Just this week, we've stood up easy drive-through testing in East County. That's Monday and Thursdays. So we are publicizing that. In general, testing yields the most if someone has symptoms or someone has known contact to someone who has the virus. So to put out a blanket statement of testing anybody who attended the protests, the protests were so large. I think my concern would be that that's not a very precise way of identifying potential cases and containing any spread from the protests. So we are starting with symptomatic first, and that may change as we learn more.
Dr. Vines, it's Ben Botkin with the Lund Report. Could you speak a little bit to the concept of whether or not wearing masks should be something that the county can make a mandatory requirement rather than just a recommendation?
Sure. So this topic has been a robust area of conversation, both internally and with our Board of Commissioners. I want to be really clear that Public Health, the county recommends wearing a face covering for anyone who can, and that's especially important indoors and when you can't maintain reliably the 6-foot distance from other people. So I want to make clear that we do recommend them. When we talk about mandating them or requiring them, that takes us into an enforcement conversation that becomes difficult in the face of concerns from communities of color, concerns about enforcement by police around other minor infractions among communities of color. And so for now, we are not going on any kind of enforcement pathway. We are trying to make a strong recommendation for them, make them available to other people, and go through a voluntary pathway at this point, because it is such a sensitive time, I think, to talk specifically about enforcement of something like face coverings. It's something that we may revisit, but for now, we're looking at it as a strong recommendation and essentially a voluntary behavior.
Can I change the topic just slightly, Chris? We keep hearing anecdotally from health professionals, mostly nurses, that they don't have sufficient PPE, yet the county's dashboard continues to say that there is more than sufficient PPE. I'm wondering if you're hearing those kinds of anecdotal concerns and how you would reconcile these anecdotal reports with the statistical numbers that you're putting forward. Thanks.
Sure. I'm happy to. So first off, let me just say that if you in our plan submission to the state, there were actually two requirements specifically by the state. One, for us to sort of work with hospitals where they attested to sort of their PPE levels, and we actually did get letters from all of our hospitals indicating that they do have adequate PPE. There was another component in there specifically about first responders also having sufficient PPE. And we did actually communicate with all of our first responders in the county as well. And each of them indicated that they had at least 30 days of supply. And that's a conversation that we continue to have. So I know that we've had that conversation this week where in our plan, some of them went out to July 30th, and now we talked to some this week, and some of those numbers have pushed back 8 more weeks. So we've communicated with them as well. And then the last component we had in there was really as we work with sort of other businesses, and we continue to supply PPE. We continue to receive PPE. I think in total we received about 5.7 million items of PPE from the state, distributed about 70% of that. And many of that are going to community organizations, but they are also going to nursing homes, assisted living, you name it, we have that process. I do think there is some PPE that is harder to come by. So we know that gowns have been more restrictive than PPE such as masks, where we've seen the supply chain improve significantly over the last couple of weeks. And I specifically with regard to masks, because I think that is probably the thing that we are asked for the most. We also test the market. So not only are we just hearing from organizations, but we actually call different vendors to see if they have supply. And periodically we'll buy very small amounts just to see if our PPE requests can actually be fulfilled in sort of a timely manner. And those numbers there, I think, I know last week it was approximately 50% of the vendors we called actually had PPE, although 25% of that were only selling in bulk. And this week it's actually almost at about 60%. So from a long-term standpoint, we are seeing PPE improve. And I think that was also one of the things that we talked about specifically this last Wednesday at our briefing with the commissioners, to sort of say that we're seeing PPE improve, and we thought that was an important metric as we put together our application for reopening.
Thanks.
And if I could jump in here, I have an answer for Shane. I got a message from my team as we've been talking. Fewer than 5 cases in Multnomah County have disclosed being at the protests. And we don't usually report specific numbers, less than 5.
Thank you.
Dr. Vines, you talked about the fact that again, the county and public health officials were comfortable moving into phase 1, given the plan and the status of all the indicators. What would give you pause in the coming days and maybe cause you to recommend that we go on a further hold? What's the indicator out there and what does it have to get to in order for you to basically say this, I'm not comfortable with this?
That's a great question. There are lots of different sources of data. There are lots of different ways to look at it to try to figure out what's the virus doing. Do we have a handle? What do we think? Where do we think we're going to be 2-3 weeks from now? Again, because of that time lag. So I think we're going to be looking at everything. One thing I look for is any kind of change in order of magnitude, any kind of doubling. Those are just general flags to me as I scan my many emails every day. that the virus is spreading potentially faster than we can contain it. But I think there are a lot of different ways to answer that question, and I think we'll be tackling exactly that in the next week.
Well, so the 7-day rolling average case count has certainly doubled and tripled over the last few weeks. Is that an indicator that would, again, give you pause?
I think we expected case counts to go up. We have stepped up our testing, and we are finding more cases by doing more aggressive testing. So I think some of that was expected. We are watching hospitalizations closely, again, knowing that many people will not have symptoms or will have really mild illness. We do want to be sure that people are not ending up hospitalized or worse from this virus. So again, our hospitalization numbers are so low, thankfully, and may they stay that way, that I think that's where we'll be looking closely in addition to other indicators.